Now that you're expecting, you've already probably come to realize that there's tons of choices you're going to have to make being a new mom. You're first going to have to decide which car seat's the safest, a name if you're going to use disposable or cloth diapers, whether you're going to circumcise or not circumcise if you're having a boy, but most importantly, if you're going to breastfeed or use formula. Humans are the only species on the planet to substitute another animal's milk to feed their infants. According to www.who.int, you should breastfeed exclusively for 6 months and then add complementary foods up to 2 years with breast milk. Breast milk is good. Breastfeeding is good for the mom and the baby. There is, though, however, a few reasons why the mother should not breastfeed, and that is if she has HIV, active untreated TB, T-cell lymphatic virus type 1 and 2, if she is dependent on illicit drugs, or if you're undergoing chemotherapy or radiation, and that's according to cdc.gov. Breast milk is the best thing that you can offer your baby if it is healthy for you to breastfeed. Breastfed babies are more resilient to diseases and infections. If you happen to become sick when you're nursing, you're going to pass antibodies onto your baby, which is going to help them fight it off if they happen to catch what you have. As well as short-term illnesses, they are less likely to develop other long-term illnesses later in life. And these are juvenile diabetes, MS, heart disease, and cancer before the age of 15. They're also less likely to develop respiratory illnesses. And if they do happen to develop respiratory illnesses, they are far less likely to be hospitalized. And this is if you breastfeed exclusively for a minimum of 4 months. It's also been shown a decrease in allergies amongst children who are breastfed. And they have even less allergies if both parents have allergies. They have more of like an immunity against them. And also, according to www.aap.org, it has been shown that when you breastfeed, there is a decreased chance of SIDS, and that's sudden infant death syndrome. So, really, breastfeeding your baby gives them healthy benefits from the start. Mom can also reap some benefits from breastfeeding. There's 3 types of cancer that breastfeeding helps decreases her chances of catching. There's breast cancer. You can decrease your chances up to 25%, and this is dependent upon the amount of time that you breastfeed. There's also uterine and ovarian cancer. Your risks of these are decreased when you breastfeed as well. Women who use formula instead of breastfeeding when they have children, they have a 4 times higher chance of developing osteoporosis and having hip fractures after menopause. And when you breastfeed, your body delays ovulation, which is going to delay menstruation longer after you have delivered. And of course, this is dependent on how often your baby eats, and it's also dependent on your body when menstruation will start back. And when you do nurse, your body produces a chemical called oxytocin. And what oxytocin is it gives you a happy feeling inside of your brain. And this decreases your chances for postpartum depression. And then also, whenever you nurse your baby, your uterus will contract. And when it contracts, it's going to shorten your postpartum bleeding, and your uterus is also going to get back to its original size quicker than if you were not breastfeeding. Not only will you reap some benefits in the short term, but you're going to see benefits from breastfeeding for years to come. And if the health benefits aren't enough to convince you to breastfeed, think about the money you're going to save. Breastfeeding alone saves you $1,500 a year. That's how much it is to buy formula for 1 year for one baby. And if you do happen to pump, if you are going to have to use bottles or go back to work, your insurance will pay for a pump if you go back to work. So that'll save you a good amount of money there as well. And all the time you're going to save away from the doctor because your baby is healthy. You're going to save from medical bills. You're not going to miss as much time at work. And you're not going to have the exposure of your child around other sick children. Now that you're expecting, you really should consider whether you're going to breastfeed or not. The health benefits you're offering them will give them an early advantage in life. And the benefits for you is not only going to help you now, but it's going to help you for years to come. And then the money that you're going to save, you can go out and you can enjoy this baby that you now have.